My name is Dr. John Wilkerson. I'm a board certified orthopedic surgeon and director of clinical services here at CitiMED. I went to the Medical College of Virginia, which is part of Virginia Commonwealth University. I also stayed there for my general surgery internship, as well as an orthopedic surgical residency, additional fellowship in orthopedic biomechanics, and then I did another year as a sports medicine fellowship at the University of Miami. I decided to become an orthopedic surgeon based off of injuries and my experience that I had growing up. In high school, I had several knee injuries, and after each time I was put back together again by an orthopedic surgeon, I learned to appreciate what the specialty could do for people, and that piqued my interest into going into this profession so I could help others. I perform several types of operations, but I do a lot of surgery in the shoulder and a lot of surgery in the knee. In the shoulders, commonly we'll do rotator cuff repairs, cartilage repairs or labral repairs. In the knee, I'll do meniscal tear repair surgery, meniscectomies, which is a resection of torn cartilage, ACL reconstructions. I also do joint replacements. I do shoulder replacements, hip replacements, knee replacements. But essentially, I'm an extremity surgeon, so anything in the extremity from the shoulder to the wrist and from the hip to the ankle is part of my specialty. I do a lot of arthroscopy procedures, which are basically procedures where a camera is used to treat diseases and pathology inside of the joint, which is minimally invasive. And so the surgical scope is mainly is arthroscopic, but again, I do a little bit of everything within the extremities. The average recovery process totally depends on the type of injury and the treatment that was performed. For example, if a patient has just a portion of the meniscus removed and it was a small tear and the procedure is called a meniscectomy, those patients are usually pretty good and ready to do any activity within about 6 weeks. But on the other hand, if you had to have a ligament reconstruction, like an ACL reconstruction, then your recovery is going to be much more prolonged. You're looking at 3 months of rehabilitation and up to 6 to 9 months before you would be cleared to go back to doing any sort of sporting participation. After surgery, a patient can expect to spend some time in physical therapy. Typically after most operations, the patient will require some time in rehabilitation. And so part of the rehabilitation process would be spending some time in a physical therapy center up to 2 to 3 times per week, sometimes more often depending on the extent of the injury. The therapy would be supervised by myself. I will write a prescription explaining to the therapist what procedure was performed and what specific activities and exercises and modalities would be performed by the therapist during the rehabilitation process. The length of therapy would vary from just 4 to 6 weeks to sometimes several months, depending on the extent of the injury. There are several options for patients who decide not to proceed with a surgical procedure. The options would vary depending on the type of injury, but some of those options would include use of medications to control any symptoms, physical therapy to rehabilitate the surrounding muscles of the joint that's affected. For example, some patients that have a meniscal tear may decide not to have that meniscal tear treated and can get some improvement in the symptoms by strengthening the muscles around the knee, both above and below. The patients are explained that there is some risk with that the tear may still become a problem and may accelerate the rate of arthritis in the future, but a lot of patients don't want to have surgery, and that's fine. It's the decision to proceed with surgery is ultimately up to the patient. My job is to let them know what's going on and what the ramifications would be proceeding with the operation and not proceeding with the operation. What I find as being the most fulfilling portion of my job here at CitiMED is just being able to help so many people. The patients are very, very appreciative of what I'm able to do for them. I want only the best for my patients that I see here, so I do whatever I can to make it work out very well for them. I just like seeing the patients have good results.